I'd like to teach you a practice that I call the breath scan that will help you to be more aware of your breath. It provides a doorway into understanding the breath in its various parts. The first thing that's important to be aware of is the basic anatomy of the breath. I have a simple diagram here that shows a simple torso. You can see you have two lungs. In the middle there's your heart. Below the lungs is the diaphragm. That diaphragm is somewhat dome-shaped. As it contracts, it flattens, drawing air into the lungs and flattening the stomach. You can see the diaphragm forms kind of a horizon line separating the upper torso from the lower torso. So the first step that we'll start with is learning to be aware of the movement of the diaphragm. So here we are. What I'd like you to do, Dave, is just to close your eyes, find a position of comfort in your body with your head, neck, and trunk in a straight line. You may be more comfortable sitting on the floor or sitting in a chair, it doesn't matter. With your eyes closed, I want you to turn your attention to the breath. Notice the movement of your body in response to the breath. You might notice movement in your abdomen, in your chest, in your neck, in your face, in your nose. Simply notice this movement. For those of you who are watching, you can certainly follow along with this exercise. Begin then at the place where the nostrils meet the upper lip. Notice the sensations that you have there as the breath moves in and out. At this point, don't change anything. Don't try to control the breath. Simply be the witness. Noticing the inhalation and the exhalation. Notice also the movement of the breath through the nostrils if you can. You may not have a sensation of that movement, but that's okay. Just turn your attention in that direction. Move your awareness then towards the back of your nasal passages, through the nasal sinus to the nasal pharynx, if you have a sensation of that. You might have a sensation of the breath flowing down through the back of your throat, down through your neck. You may notice some sympathetic movement in response to the breath. Move your awareness down into your upper chest. Again, with the inhalation and the exhalation, you may notice a change in sensation in your upper chest. Move then your awareness down into your lungs, deep towards the center of your chest. Again, you may have a vague sensation of movement of the ribs, movement of the lungs themselves. Move your attention then all the way down to that diaphragm, that dome-shaped muscle that separates your chest and your abdomen. In most people, the diaphragm is the main muscle of respiration. If you have a difficult time feeling the diaphragm, you can take your right hand and place it over the top of your abdomen so that your little finger is about at the level of your navel, your thumb is over your sternum. You can take your left hand and place that over the top of your chest. Continue to just allow the breath to happen without changing it. For the moment, still seeking to concentrate on the movement of the diaphragm. As you exhale, the diaphragm relaxes, the volume of the lungs decreases and air is expelled. As you inhale, the diaphragm contracts, pushing down into the abdomen and drawing air in. This is already happening. It's been happening for a long time. We're just asking you now to be aware of it. When you're ready, you can release your hands down to your knees, and again extend your awareness upwards into your lungs, movements of your ribs, upward through your upper airway. You might have a sensation of air moving through your chest and through your neck. Some people have a sensation of their clavicle moving or their neck moving in response to the breath. Simply be aware. And move your awareness upward into the nose, and finally back to the place where the nostrils meet the upper lip. When you're ready, expand your awareness to the entirety of your body and give yourself a snapshot of your current mental state. Do you feel relaxed? Do you feel tense? How do you feel? And when you're ready, slowly open your eyes. And the exercise is complete.